Let's begin a three-part series and answer the question, can my dentist help with my headaches? The answer is yes. Roll that intro. What's up, everyone? Dr. Eric Jackson here. So like I said in the intro, we're going to talk about headaches today. A three-part series because it's a rather in-depth conversation like we usually do on this channel. So let's start off with just kind of a background. You know, everyone gets headaches. We're not talking about those headaches. Occasional headaches, mild, infrequent. We're talking about chronic headaches with a regularity, right? And so these headaches are incredibly frustrating, incredibly painful, and just really a nuisance for a great percentage of people on this planet. In fact, one statistic shows that headache sufferers in the United States receive $1 billion of brain scans each year attempting to figure out the source of their pain. That's amazing. That's a tremendous amount of money and a tremendous amount of scans. Without a doubt, however, I always point out the first stop on the discovery bandwagon is your primary care physician. It's very important to rule out medical conditions that might be causing your chronic headaches. There are a litany of them. We're not going to get into them here because that is for the medical doctors to worry about. But we often work alongside those medical doctors because you'd be surprised the prevalence of dental causation of chronic headaches, which is the whole reason why you're watching this video. First things first, we need to do a little bit of background, a little quick review about headaches in general. Headaches are typically classified into two different categories, primary headaches and secondary headaches. Primary headache is one that is not directly caused by an external factor, right? People may carry genes that make them more likely to develop such headaches. Primary headaches are typically divided into three main categories, of which you probably recognize their names: migraines, tension, and cluster, right? These headaches you're probably familiar with. Migraine headaches generally present with moderate to severe pain, and it's a pulsing, and it's generally on one side of the head, and that's kind of like your classic migraine, right? Tension headaches are usually more diffuse, mild to moderate. Often the word squeezing is used in that description. Even though, and interestingly, the tension headaches are the most common of the primary headaches, but they're actually not fully understood yet. They're still learning quite a bit about them in medical science. Cluster headaches being the third of the three categories, it's more of an onset. It's an attack, right? It's an attack of severe pain on one side of the head. It can be short term to long, to medium term, 15 minutes to 3 hours, and occurs sometimes once every other day, and up to 8 times a day. Although not a direct cause, primary headaches often have triggers which bring about their onsets, right? Some headaches can be triggered by lifestyle factors like alcohol, especially red wine, certain foods like processed meats that contain nitrates, changes in sleep or lack of sleep, poor posture, skipped meals, low blood sugar, and stress. Stress is always part of most maladies, right? Chemical activity in your brain, the nerves and blood vessels surrounding your skull, the muscles of your head and neck can also play a role in triggering primary headaches. All this is still being learned in the medical science, which we're not, like I said, we're not going to get in here. So that's primary headaches. Let's talk secondary headaches. A secondary headache is a headache that typically presents because of another condition. The classic example is a sinus headache because of acute sinusitis. That is just one of many, many different types of secondary headache causations out there. It's a lengthy list. I'm going to even edit this list down a little bit, but I'll put these up there on the screen. Just so, because you might not even realize that some of these conditions and situations can cause headaches, right? Possible causes of secondary headaches include acute sinusitis, like I mentioned, but also something severe like arterial tears, blood clots, blood sugar levels, brain aneurysms, brain tumors, carbon monoxide poisoning, concussion, dehydration, ear infections, glaucoma, hangovers, high blood pressure, influenza, fevers, intracranial hematomas, medications, meningitis, monosodium glutamate, MSG, overuse of pain medications, panic attacks, panic disorders, pressure from tight headgear like a helmet or goggles, swimming goggles or whatnot, stroke, toxoplasmosis, trigeminal neuralgia, and poor vision. Some of those are obviously very severe, like a arterial tear. Others are not poor vision, although it's a low severity per se as far as a morbidity. Ultimately, it's a day-to-day problem for people. These are real-world issues that people are dealing with. So that lengthy list is heavily on the medical side, which is why ultimately it's very important that you speak to your medical doctor, primary care physician about your chronic headaches prior to you or concurrently to you discussing them with your dentist. So the next segment of the video series, we'll talk about secondary headaches that have dental causes, exclusively dental causes. Those will be essentially dental maladies, things like toothaches and broken teeth and sensitive teeth and whatnot. Dental malocclusion, crooked teeth, right? And then finally, bruxism, clenching, TMJ type issues. Thank you for watching. I appreciate it very much. As always, I love going into things in depth. This video format allows me to really kind of give it a more in-depth, visually appealing, educational process. Please consider subscribing to the channel, like the video, and as always, comment below any questions or comments that you might have. Thanks so much for watching. I'll see you in part 2. Take care now. Bye-bye.